that is right in the middle of that nerve, because of the way the vascular nature has to open up in front of the neural tunica of the retina. Okay, what is the next?
Ciliary body and ciliary muscle.
The ciliary body and ciliary muscle. I'll show you on the lateral view here. On the lateral view, the ciliary body is this bank of muscles up here. And let's get real close so you can see this. Ciliary muscle right there in the iris, helping to open and close the aperture of the pupil, allowing more or less light in. And there's a ciliary body that helps, and you can see it right here with the suspensory ligaments that help put tension on this lens to help adjust the shape of the lens, creating different focus. Okay, what else you got?
Crystalline lens.
Crystalline lens is right here, and before 30 years old, this is pretty semi-flexible, but as you hit about 40, it really starts to harden up, and this creates a condition known as presbyopia, because you have a harder and harder time accommodating close objects. That's why you see people, when they read as they get older, it seems like their arm isn't even long enough to hold the book to see. They need reading glasses after that. That's presbyopia, because this crystalline lens here, and you can actually see it. Let's see if I can do it. It's kind of interesting. It's been damaged too much to actually be able to see. But up close, compared to this eye, this is a pretty good representation of what you can see. Now what's the next thing?
Retina.
Now the retina is this whole area back here. The retina. Now we're just, at this class, we're just giving you that general back layer. It has multiple layers, but we're just using this as our retina for right now, this thickened area.
Optic disc.
Optic disc, remember there's the optic nerve right here. Looking straight back would be like this. So the optic nerve, notice, off to the midline. So when we look inside, you can see off to the medial aspect, this is our optic disc. There are no rods, there are no cones. So no vision is here. This is our blind spot. And you can see the blood vessels coming up through this area.
Optic nerve.
Optic nerve, once again. Cranial nerve number 3, optic nerve.
Macula lutea.
Macula lutea. I have to use the other side right here. Put this back together. So when we're looking straight on, right eye, if vision was to go exactly straight back, I'm going to use this other half to show you this one. The macula lutea is this pigmented area back here. Sometimes a general sense they just call this the macula, like macular degeneration. This is where you get general sight focus straight ahead. When you look at someone's face, you recognize their face. Things that are straight in front of you in a very larger sense. Where within this, and it's almost hard to actually physically see this with the naked eye, but this next area, next one,
Fovea centralis.
that fovea centralis is kind of a pinpoint area. Here it's represented as a little small concave area. This is where we get fine focus. Like when you read words on a piece of paper, that's where that is at.
Anterior cavity.
Anterior cavity. The anterior cavity. Now I got to get this one here. Anterior cavity, basically our dividing line. I'm going to do anterior and posterior cavities because right here we have from the lens back, this whole region right here is our posterior cavity. From the lens forward all the way through, see, I'm going to get it at an angle here, you can see it. From the lens forward to the cornea, this is your anterior cavity. Now there's two kinds of fluid that's in here. Back here is a kind of a gelatinous, kind of like a real thick hair gel consistency, almost like a real thick jelly, gelatinous substance. It's called the vitreous humor. In the front, the anterior chamber, and this would include these two divisions in front and behind the iris. Anterior chamber, that's in front of the iris. Posterior chamber would be between the iris and behind the pupil to the lens, all this area back here. Is your posterior chamber. It's like the anterior cavity has two chambers, in front and behind the pupil, or the iris, I should say, but in front of the crystalline lens. The fluid that's inside here is more of a watery type substance, so we call it aqueous humor. So any kind of injury to the eye, it's essential. If it is just watery, runny, it's going to be aqueous humor. If it looks like hair gel or real thick gelatinous type, that means there's damage all the way to the retina.
The lateral rectus muscle.
Okay, the lateral rectus muscle, I'll use this other model again. It's more intact. Right eye, so lateral rectus muscle.
Medial rectus muscle.
Medial rectus muscle.
Superior rectus muscle.
Superior rectus muscle.
Inferior rectus muscle.
Inferior rectus muscle.
Superior oblique muscle.
Superior oblique. Here, I gotta be careful, this falls apart. Remember, this is a right eye. Excuse me, this happens to be, I'm sorry, this actually is a left eye when I looked at this. So this particular one is a left eye. It's the other model in this one. So we actually got, be watching you. So when I looked at our superior oblique, and here's how it always goes underneath that superior rectus muscle, and it goes to the midline, to the medial aspect, because the belly of that muscle is against the ethmoid bone, which is in the medial aspect of the orbit of the eye.
Inferior oblique muscle.
Inferior oblique muscle, we can see it crossing over very carefully here. This is going from the lateral aspect to the medial aspect, overlying or more superficial than the inferior rectus. And And let me show you this other model.